start the recording and say hi to everyone, and then we'll get started. I don't see any random added, so I'm just gonna get going. Sometimes I wait a few minutes, sometimes I don't. I think we're pretty good. We'll start. Hopefully everyone sees my slides. That's always a question mark of the day. So thank you for joining. I'm Kira. I'm joined by Manasvi and Dr. Simoyan, and I'm really excited for this presentation, so I might talk a little fast through my presentation slides. We are Free Health Shadowing. We're an international, student-led, and nonprofit for medical advancement. We work primarily with these live shadowing sessions, but we also have a few random little things, tidbits. We do have some partnerships with people who give you more resources for being a pre-med student. So if you're questioning that or you have any questions, you can always email us. But talking about that, we're going to say closed captions, if anyone needs them. We do have those accommodated through Zoom. So if they are not ideal or nice, I'm sorry for that. You can email us at info@freehealthshadowing.com and we can help you with notes or a transcript or whatever else you need. We do have this recorded, so if you do have some kind of other assistive device that can help you with that, this will be recorded and uploaded for anyone. And if you have any ideas about how we can be more accessible, let us know in the chat, or you can email us as well. I'm going to go ahead and say, if you want to stay in the loop, we do have an email list. You can follow us on social media as well. If you do add us to your email list, make sure you add us as a contact, because sometimes those go to spam. Even replies to your emails sometimes go to spam if you don't add us. We do have an Instagram, TikTok, Twitter, which is X now. I'm still going to call it Twitter. We also have Instagram, or we also have YouTube and LinkedIn that are not posted on here. So one of my questions I always ask people are, where are you guys all joining from? I was going to say calling from, but it's not really a call. Where are you joining from? I'm in Los Angeles, California. I know that there's a few people in the chat. Hopefully lots of people stay in the chat. Ooh, someone's from Arizona. Las Vegas, Nevada. Of course, we always see the Nevada people. McAllen, Texas. I don't even know where McAllen is. New York, Michigan, San Francisco, California. Los Angeles, but from Iowa, or in Iowa right now. That's an interesting move. Massachusetts, Pennsylvania, San Jose. Hi, Manasvi. Okay, I'm gonna close that for now. North Carolina, I saw you. Okay, moving on though. So if you're interested in being a volunteer with us, volunteers help with these sessions, but they also help with anything and everything that makes up pre-health shadowing. It is 100% remote. There are some times where they're not remote. If you are interested in that, I would follow our social media. That does get posted. And you can volunteer on our website. You just have to go to the Get Involved tab and join our team. Or join the volunteer department. Joining our team is a different thing. It is a leadership team. It does count for leadership experience, and you can write that on your resume, and as well as when you're writing your applications to med school, you can also include this. We are recognized by the AAMC, which is a great thing to add onto your resume, and it's also 100% remote, but it's a little bit more of a time commitment. If you're looking for something that's less of a time commitment, I recommend volunteering. We have various roles within our leadership department. In IT grants, fundraising, recruitment. If you notice at the end, it says "and more." You are able to create your own position if you notice that maybe the position's not even listed on here. And so if you're going to do that, you can always just reach out and say, here's all the skills I have. Here's the role I was hoping for. I noticed you don't have it. And you can kind of create your own role through our Join Our Team section. We are fully functioning and have a lot of different roles, so I'd be a little surprised, but maybe you'll be the black sheep in the bunch and create your own thing. If you're a high school student, we do have a high school training program, and that's for healthcare education for pre-college learners. That program is also listed on our website. So if you're interested in doing that, or if you are in high school and you just have some questions about how that starts up, it is a kind of a club or an organization that gets set up on your campus by you and a few of your friends, because normally you're required to have a few people that sign off on as well. You can go fill out the interest form and learn more about that opportunity. So something that I'm excited about is having diversity panels. We've had them in the past. I haven't had them in a little while, and I'm excited about it. So if you know anyone that is inspiring and talks on racial disparities or LGBTQIA Health plus, which or sexism, anything that's kind of a diverse topic in medicine or even outside of medicine, we'd love to know their name, and you can nominate them for a future panel by going to our website or by emailing us at info@prehealthshadowing.com, and we'll love to reach out and see if there is something that we can set up for the future. Our program is completely free to students, actually completely free to anyone. I know that there's a few doctors even that shadow with us sometimes. And so in order to stay completely free, we do ask that anyone who can donate does donate. We ran solely off of time and donations from volunteers or our organization or people or partnerships. So if you guys have some few dollars to spare, we'd love for you to scan the QR code. And if you don't, you can always share this QR code with a friend, a colleague, anyone that you think will donate some money. That would be great. And we're appreciative of anything, even a dollar. And if you can't, I always encourage volunteering. We love your time. Give us all your time. If you have questions, I would post those in the chat. We do make note of all of the questions, so don't worry that your question's going to get among the flurry of other questions. So make sure that you just post those or have them written down somewhere, because sometimes at the end we get frozen and forget where we are in the world. We don't have any questions then. So I will make note of those during the Q&A. I know that Dr. Simoyan might be answering a couple of those while she goes, but we will have some time at the end for the Q&A. So take good notes. We do have a post-shadowing assessment that's available at the end. If you've clicked on it already, it's not going to open until the end of this session, so you can't take it yet. Just to verify your hours on our page, and we'll let you know how that works at the end of the session. So if you can turn your cameras on, I always love seeing faces. I'm sure Dr. Simoyan also loves to see your face and not just a blank screen. But hopefully, oh, Derek, you're on. You've made it. Thank you for joining. And Dr. Simoyan, I leave it up to you now. Thank you so much.
Thank you, Kira, for having me. And thank you, everybody. Can you all hear me? Okay, great. Thank you for having me here this evening. So I always I appreciate the opportunity to speak to future doctors, future healthcare professionals. So I just appreciate this opportunity, and I hope that we'll have a meaningful time together. I don't want it to be like, very formal. I do have slides, but I'm not going to bring them up just yet. I just want to spend a few minutes just chatting with you guys and telling you a little bit about myself, and then we can go into the slides. So, I'm Dr. Simoyan. I live in Reading, Pennsylvania right now, just outside of Reading, Pennsylvania, and I'm an addiction medicine physician. But I didn't exactly. I took anything but a straight a straight path to get to where I am today, and that's one of the things that I actually like to let people know, that you don't have to have one straight path. There there's so many things you can do with your life. Being a doctor or other healthcare professional, or a professional in another setting, in another specialty or another field, is all well and good, but you might also be a writer, and you don't necessarily have to put your writing or your other interests aside just because you're pursuing a career. You can do more than one thing at a time. I really like to emphasize that. And so I actually grew up in Nigeria, and the educational system was more fashioned after the British system. So we went into university right after, went into university for professional training right after high school, really. So the first year was a prelim year, but after that we started preclinical. So I went to I went to the University of Ibadan in Nigeria. I entered university at the age of 15, and I 6 years later, I was a dentist. So yes, before I went to medical school at Penn State, I was actually a dentist. So I got my dental degree at the age of 21, yes. And I actually did some postgraduate work in pediatric dentistry, but I always wanted to do more. I was constantly feeling like I wanted to do more. I had this kind of like save the world mentality, and I had heard that if you had a public health degree, a master of public health degree from Johns Hopkins, there was a job waiting for you. So I had these dreams of, okay, maybe I'll go to Hopkins and get an MPH, and then I can go work for the WHO or UNICEF or one of these big international organizations. So anyway, long story short, I'm not going to tell you all the details because it was a very, very long story, but I did end up going to Johns Hopkins, got my MPH, but that wonderful international job wasn't waiting for me. It wasn't waiting for me, but because I had my dental training, my dental degree, it was easier for me to get into a dental public health residency. So from when I left Baltimore, I went to New York, went to Montefiore Medical Center and did a residency in dental public health. And then I stayed on with them for a couple years, and and again kept wanting to do more, kept wanting to learn more, do more, and just I kept having this need to this, should I call it a need? Well, maybe it was a need because of my desire to just do more and get more education. I decided, you know what, maybe I should just go to medical school. And because I had originally considered medical school, but then for a number of reasons, and partly because I again knew that I had a lot of interests and wasn't sure I would have time to do all the things I wanted to do if I was a physician and always on call. So that kind of pushed me towards dentistry earlier on. And then years later, I was like, still feeling like, maybe I really should be a physician. So anyway, so I ended up going to medical school as a second career student, and I went to Penn State College of Medicine in Hershey. So I graduated in 2006, and then I ended up doing a residency in, long story, I finished my residency in family medicine, but I had actually left a combined family medicine and psychiatry program. So I got a little bit of psychiatry training in my first year during my internship, but I didn't complete the psychiatry training. And so let's just put it this way. I have more psychiatry training than the average family medicine trained physician, and I have done a lot of work with, excuse me, I've done a lot of, my work has kind of pretty much focused on behavioral health, but there's a lot of psychiatry involved in all of that. So I finished my family medicine residency, came back to Penn State, finished my family medicine residency, and then went to what was then a brand new medical school in Scranton, Pennsylvania. It's now part of Geisinger. It's the Geisinger Commonwealth School of Medicine, but then it was a brand new independent medical school called the Commonwealth Medical College, and I was part of the founding faculty there. So starting a medical school is not an easy thing, and I mean, I didn't start it obviously, but I was there in the those early days. It was very, very challenging, and when I got there, I had been given the impression that they were going to start a faculty practice. So I thought that they would start a faculty practice, and that's where I would see patients. And somehow or other, again, the challenges of starting a new medical school, their priorities were the students, accreditation, and all of that. So I had to find creative ways of staying clinically active. And I already had this interest in addiction medicine and behavioral health. So I started working. I actually did some clinical work at what was called Scranton Counseling at the time. It was an outpatient mental health center. I worked in their child psychiatry department, and I started working as the director of a methadone clinic without any experience. I was their medical director. They were setting up a brand new methadone clinic, and they needed a medical director, and someone put them in touch with me. And anyway, so that's how I got started in clinical addiction medicine. And from one thing led to another. I worked in other clinical facilities while I was still on faculty at the medical school. I got experience, got board certified in addiction medicine. And before I left the Scranton area, in 2020. I was the program director for the Addiction Medicine Fellowship for Geisinger. So my last couple of years within the Geisinger system, I was the program director for the fellowship. So that's kind of like, and then I got recruited to where I live right now, even though I'm no longer at that job, but I got recruited to an addiction facility that was building a research center to be their medical director of research. So I hope that by telling you all this, you see that there's so many different things that you can do. And yeah, your life, your career doesn't have to be one straight path. So anyway, I got recruited to be the medical director of research at this addiction facility. And I worked with them for a few years trying to set that up. And then now, right now, I'm actually focusing on my writing. I do a lot of writing and publishing on my own, yeah, and really focusing on my personal projects. I still do some work, some clinical supervision remotely right now, but I'm not doing working at a regular practice. So it's yeah, that might have been a little bit long-winded, but that's just a little bit of background in terms of how I got here. And then now I'm going to go into my slide presentation. Hopefully this works. Let's see, share. Where is it? Okay, there it is. And I'll be going back to say a few things about medical school. We tried this earlier and it works. Now it's not showing. Now it's not showing me. It's not showing me the option to share my slides. Virtual shadowing. So okay. Oh, here it is. Okay. All right. All right. So are you seeing them now? Can you see my slides?
Yes,
Yeah,
we can.
Okay, thank you. Because I can't see you anymore, so I'm not going to be able to see your gestures. So I want to focus this talk on my latest project, which is really about celebrating women in medicine. And I'll tell you about how I got started on this whole project. But let's first of all talk about Elizabeth Blackwell, who was America's first female physician. She attended Geneva Medical College in 1849, and she graduated in 1849, and she was the first female doctor in the country. She has such an amazing story, and we're not going to go into too much detail, but I will say a little bit about her. When she applied to medical school, again, the students were all male, right? And the dean said that she would only be accepted if they took a vote among the students and if they agreed and they all had to agree to allow her to attend. Can you imagine? What a way to make a decision about whether or not someone could attend medical school. So, and if even one person voted no, then they wouldn't be able to offer her that position. So as the story goes, the male medical students thought it was a joke. They apparently thought it was a joke. So they're like, of course you can come. And so they all voted yes. And lo and behold, because they voted yes, she had to be accepted. And that's how she got accepted to medical school, and they were surprised when she showed up ready to start her studies. Anyway, her sister also was, her younger sister, Emily, became the third female physician in the country. And together they did a lot of wonderful work. They really supported other women physicians back then. They co-founded the New York Infirmary for Women and Children. And she, Elizabeth, authored a number of books, including some of the ones I have listed there, Medicine as a Profession for Women, and pioneering work in opening the medical profession to women. So I like to include inspiring quotes from people. And so this is one of her, I think this should be on slideshow. Just a minute, sorry. Yeah. So Elizabeth Blackwell, Dr. Blackwell says, it's not easy to be a pioneer, but oh, it's fascinating. And she said she wouldn't trade one moment, not even the worst moment, for all the riches in the world. And I think that that's very profound. So next, I'm going to talk about Dr. Ida Sophia Scudder. And now I'm going to go back to talking about my experience in medical school, because that's how I found out about her. So I went to Penn State, as I mentioned earlier, College of Medicine. And our school had the honor of being the first US medical school, maybe the first in the world, but definitely the first in the US to have a department that was dedicated to the humanities. And we had a strong emphasis on the humanities. We had required humanities courses that we had to take. And particularly in the first year, there was a lot of reading and writing and talking about things that were had not typically necessarily been part of the medical curriculum, like talking about spirituality in healthcare, caring for the poor, the history of medicine, to name a few topics. We would have group discussions, we would write essays, and then we would have speakers come and speak to us on these different topics. So, excuse me. In addition to all of that, we also had a center, the Kinley Center for Humanistic Medicine. And there were a number of programs that were run out of the Kinley Center. So one of our professors in that department told me about an opportunity to do a history of medicine project. So this was not a requirement. This was something that I just did outside of classwork. And I decided to look into the history of medical missionary work. And that's when I learned about Ida Scudder. So I learned about other people too. I read about Albert Schweitzer and his work. But I want to spend a little bit of time talking about Dr. Scudder, because her story was just so incredible. She was born in India to American missionaries. Her father was a doctor. Her grandfather was a doctor as well. And she had no plans of following in their footsteps. She didn't want to stay in India, and she didn't want to be a missionary, and she didn't want to be a doctor. So she had actually come back to the US to further her education. And then she was back in India just visiting her parents, and had a very life-changing experience. And, sometimes things happen and it's like, wow, this, that one incident just changes the course of your life. And the course of many other people's lives, potentially. And that's what happened in her case. So she was visiting her parents in India. And in one night, a gentleman comes to her to ask for help for his wife who was in labor. And she didn't have any medical training at the time. So she was like, oh, my dad is a doctor. And they were like, the guy was like, no. He wasn't going to let a man touch his wife. And Ida couldn't help because she didn't have any medical training at the time. So the man left. Shortly after that same night, another man comes with the exact same request. Can you come and help my wife who is in labor? And the response was exactly the same. He wasn't going to let a man touch his wife. Excuse me. So, I mean, if you're wondering what kind of coincidence that was, I mean, what are the chances? Twice in one night, the same request and the same response? Well, there's more to the story. That same night, a third man came with the exact same request. Can you come help my wife who is in labor? And the response was exactly the same. I can't let a man touch my wife. And then, all right, so that happened. She went to bed. The next morning, there was wailing. What is going on? Well, something terrible had happened. Actually, not just one terrible thing, but 3 terrible outcomes. All three women had died in labor that night. So essentially, these 3 women died for lack of a woman physician, because there was a male physician who could have helped them, but the culture their cultural beliefs at the time were that, they didn't think it was appropriate. And unfortunately, all three women died that night. So Ida just struggled and struggled and struggled with this. And she's like, she felt so upset. And she's like, she started wondering what she could do about this, And so she, excuse me, spent time praying, and then eventually decided that this was God's way of telling her that she needed to do something about it, and she was meant to do something about it. And then she made the decision that she was going to become a doctor and come back to India to help the women of India. And then she went and told her parents that, and she did just that. So she came back to the US and went to medical school. So this is her as an anatomy student. And this was in the 1800s, remember, when it was difficult for women to get into medical school, even here in the US. But she did it. She became a doctor, and then she went back to India and basically spent the rest of her life there. So they started out, they had roadside clinics, started training nurses, and eventually started a medical school for women. And it's now known as I think it was originally called the Vellore Medical College. It's in a place called Vellore in India, but it's now called the Christian Medical College. It's one of the top medical schools in India. And guess what? In 1947, they diversified and they started accepting men, but it was initially started as a girls only, women only medical school. So that's just that's yes.
Your slides aren't going forward.
Oh, they're not?
I didn't want to cut you off, but I'm going to cut you off right now.
Oh no.
But do you want me to share the slides and you can see people's faces?
Oh, please. Okay. So you didn't see any of them?
No, we saw all of them except when you started talking about Ida.
So what are you seeing right now?
The quote, Elizabeth Blackwell's quote.
Oh, and right now I'm on Ida's quote. I mean, Ida's slide.
Maybe you're on it. You have two different ones, but if you want to cancel that, I have yours up, and I can.
So should I just stop sharing?
Yeah.
I wonder what happened. But thanks for telling me. Thanks for telling me. I once gave a presentation. Unfortunately, it was only a handful of people, and it was only at the end of everything that I realized that they weren't seeing my slides. Oh dear. So I did stop sharing, but it's okay. Yeah, so I'll look at them here and just tell you when to go to the next one. Do you have it up?
Yes, I do. And I'm sharing it. Can everyone see it? I hear, yes. I see them just nod.
Okay, so can you go to the so after the roadside clinics, did you see can you go to Ida's slide, and then the first one, that's just introductory, and then the next one, her as a medical student, just so that they can see what I was showing. Can you see that? Her with the did you find the slide?
Yeah.
Okay, yeah. So are you showing that one?
Yeah.
Now? Ida as a medical student. Okay. Now can you go to the next one? That's the starting roadside clinics, just so they can see, and then we'll.
It's on that one now.
Okay, and then the next one. So the next one, these are pictures that I actually took when I had the opportunity to go to India as a visiting medical student. So when I was learning about Ida Scudder, we had, fortunately, somebody from Vellore CMC came to visit our medical school, and they have a board in New York. So one of the, I think he was one of the board members from New York, came with a doctor who was actually from this medical school in India, and talked to us about CMC and about the school. And we found out that we were able to visit as international visiting medical students at, fourth year electives. So I made plans to visit in my fourth year of medical school, and it happened. So those are pictures that I actually took when I went to India in 2006, just before I graduated. All right, so next slide, please. So now I'm going to talk about contemporary contemporary women in medicine. And it's always important to, I mean, I'm sure you guys all know that mentoring is very important. So I had my department chair when I started my first faculty position at what is now Geisinger Commonwealth School of Medicine was Dr. Janet Townsend, and this is her. She was the founding chair of the Department of Family and Community and Rural Health there, and then she recently retired from, being one of the senior deans. She's also served as a president of the Society of Teachers in Family Medicine as well. And she's somebody who was very, very supportive of my of all of my interests and ambitions and all of that, because I just had a very, from listening to me, you probably can tell that I didn't have a typical career. It was one thing to not have had a straight path into medicine, but even after that, I've done a number of things, and just it's just important to have the support of the people you work with, the people that supervise you, and all of that. Otherwise, it just might not be possible. She supported my applying for and getting the Fulbright scholarship. So I went to Nigeria as a Fulbright specialist scholar. Uh, I did 3 short trips between 2012 and 2014. She also supported so the Europeans have a similar program. And so she supported my application to that program as well. It's funded by the Erasmus Mundus scholarship program. And the program that I participated in is called Europub Health. So there's a consortium of European medical schools that participates in this program. And then they have students from all over the world attending public health schools at these different schools. But the students actually end up spending a year in one school, and then they go to another country and spend another year there, and they end up getting 2 master's degrees in public health. And in between the 2 summers, they have a, what do they call it, an integration module where they all come together to the public health school in France. And I got to be a scholar in that program in 2012. So it was just an amazing experience. But I'm telling you that again, I want you to know what's possible, what's possible as a doctor, but I also want you to understand how it's important to have the support of, the people who employ you, people who are your supervisors, institutional supports and all that. It really can make a difference having the right people on your team. And then, so some words of advice from Dr. Townsend. So I'm just going to read this. So as physicians, by connecting to patients through simple personal questions, we connect them to hope. In small ways, our attention to patients' unspoken fears helps to maintain that emotional quality, hope, so essential to well-being. Let us raise our collective voice in support of a system of care that makes room for listening to patients, to each other, and to communities. And it's so true. It's so important to listen to our patients and to also listen to each other. And the one thing that I don't want to forget is that this whole Women in Medicine project started. Yes, I had learned about Ida Scudder in medical school, but then I now, when I was in Scranton at Geisinger Commonwealth as a faculty member, I got to the point where I was feeling restless and wanted to do something different. And so I found out about this medical humanities fellowship that I could do through Georgetown University School of Medicine. And so I became a fellow in that program. It wasn't a full-time thing. I was able to do most of it remotely. But then I did make a few trips to Washington, and I visited their campus. And during one of my visits there, I saw in one of their buildings, they had all these portraits of people in white coats holding up books. It was part of a campaign to encourage people to read. And I thought, oh, wouldn't it be nice to have something like an exhibit of women physicians, to encourage and inspire other people. So, and I had to do a project for the humanities fellowship. So that ended up being my project. I curated a small exhibit of women in medicine. And And that's how come I ended up having these, taking pictures of people like Dr. Townsend, and then having some older pictures, historical pictures as well, and then including inspirational quotes. And it was only, actually just this past September, I actually published a book that grew out of that project. And we can talk a little bit about that at the end. So faculty development is also very important. For one of our faculty development programs, Dr. Debbie Salas Lopez came to speak to us. And basically she's holding up one of her publications in her hand. It was titled Women Leaders, Challenges, Successes, and Other Insights from the Top. She was the first female chair of medicine at Lehigh Valley Health System, and now she's Senior Vice President of Community and Population Health at Northwell Health. And she has a nice inspiring quote here. My mission is to help others. Okay, so are you moving the slides? I just remembered again that you can. So Kira, are you moving the slides? Hello?
Sorry, I couldn't unmute myself. Yeah, I am moving the slide.
Okay, thank you. Yeah. So it should be on the quote from Dr. Salas Lopez right now.
Yes, it is.
Okay, thank you. For a minute, I forgot and I was advancing them here, and then I remembered, oh, okay, thank you. So she says her mission is to help others overcome obstacles. As you climb, you have to lift. So I think that that's a good piece of advice too, as as you think about your careers and think about what you want to do, right now you might feel that you're not really able to help people much, and that you're the one who needs help, but you never know which classmate or whoever you might inspire. And then as you make progress and everything, again, you want to think about helping people, whether it's high school students or whoever, helping them and inspiring them. And it's just I think it's a really good attitude to have. So another person who was in my we can go to the next slide now, in my exhibit, was Dr. Satya Jaganathan. She was my classmate and my roommate when I was at Hopkins for the public health year. And she went back to India, where she's from. And she's a pediatrician and a neonatologist. And she was working in a teaching hospital where they had a significant infant mortality rate. So at the time, she was like, because they had this like very fancy equipment that, when it broke down, there was no one could fix it. And it was like, what's the point of having, these incubators that are worth probably thousands of dollars if we can't maintain them? So she worked with the local electricians and carpenters, and using locally available materials, they were able to design low-cost incubators. And guess what? They were able to significantly reduce the infant mortality rate. So this is a quote from her. I was deeply moved by the plight of women when their babies died. Working together with local electricians and carpenters, we designed low-cost incubators made from locally available materials. The infant mortality rate at our hospital was reduced by almost 50%. So that's just one example of just having a creative approach to problem solving and using locally available materials. So sometimes it's not about how much money you can spend, but it's more about, creative, again, having a creative approach, and using things that are, locally available, saving money and saving lives at the same time. So when I went to Lagos, Nigeria as a Fulbright scholar, you can go to the next one. I met Dr. Fola Shade Okunshola. She, at the time, was the first female provost of the of the College of Medicine at the University of Lagos. And now she's currently the first female vice chancellor of the whole university. So I want to read her quotes. She says, for as long as she can remember, she's always wanted to be a doctor. And she would actually line up, maybe many of you did that, to line up her dolls and give them injections, playing doctor. But we might laugh at something like that, but there's actually research that shows that playing with dolls is actually beneficial. So just something to remember. You can as well. So Dr. Okunshola was the, like I said, first female provost of the medical school at her institution, and now she's the first vice chancellor. But she was also, excuse me, she played a pivotal role in the during the Ebola outbreak in Nigeria in 2014, and she's just had a very, very amazing, amazing and influential career. At the time she became provost of the College of Medicine, the school was 50 years old, and they hadn't had a female provost prior to that. So you can go to the next slide if you're not there already. This is a quote from her. Some advice that she gave: you'll have to work harder and smarter to be appreciated, so buckle down and start working. Being female in a demanding job, juggling the home life and work life is a daily struggle. I had my third child just before I traveled abroad for my PhD. Those were hectic days, lots of juggling, as I was constantly reading or doing one exam or the other. But I learned that you just deal with one day at a time. Break things down into small, chewable sizes and deal with them one day at a time. Your choices, your daily choices will become your achievements or your failures. And I think that that's so, so true. You know, our habits are the things that end up, you know, becoming becoming our achievements or our failures. So that's another piece of profound advice. So creativity is another thing I like to talk about. Whether it's writing, whether it's music, you know, I do both. But sometimes creativity might be, you know, working with local electricians to, you know, see how we can make incubators for for a fraction of the cost and save lives. You know, creativity comes in many forms. And you may have heard of Dr. Danielle Offrey, who she's a physician at NYU, a clinical professor at NYU. She's also the editor of Bellevue Literary Review, which is a narrative medicine journal. But she's one of the pioneers of narrative medicine in the country, I would say. She's authored several books, including When We Do Harm. But she also plays the cello, as you can see in this picture. So again, I really think that we're more effective, and we're, even as physicians, as whatever work we do, when we bring our whole selves to what we do, I think that makes us more effective. So again, don't ignore your hobbies, don't ignore your passions. See how you can, even if you can incorporate them into your work, you know, just in terms of avoiding burnouts, you know, your hobbies and passions can play a significant role. And sometimes you might be able to incorporate music into your work, as we're going to see. Anyway, so we can go to the next one. Dr. Offrey's advice: try not to lose all your outside hobbies and passions when pursuing medicine. Not only will they keep you sane, which is true, but they'll give you something to talk to your patient about besides their impending colonoscopy. So very interesting. All right, so next I want to talk about Dr. Mary Roro. She's the chair of the American Medical Women's Association's Music and Medicine Committee. And you can see her holding her viola in the picture. She played the violin as a kid, and her mom would take her to the nursing home and she would play for patients, and that really left a lasting impact. It made a lasting impact on her. There's a particular incident where there's a patient who hadn't spoken for a long time and was very depressed. And when she heard Mary playing her violin, she just brightened up. She started talking, she started singing and communicating. And it was so touching. You know, the nurses were so moved. And it really made an impact on Mary. She already knew she wanted to be a doctor. And she decided that, you know, when she became a doctor, she would incorporate music into her work. And that's what she actually does now. She works with veterans, and she incorporates, you know, veterans who are suffering from PTSD and other mental health conditions. She is a psychiatrist, and she incorporates music into her work. And she does a lot of other amazing things too. She also writes songs and does a lot of presentations. Excuse me. And then we have next one, please, Dr. Lisa Wong, who's a pediatrician and a musician, as you can see as well. She is the co-director of the Arts and Humanities Initiative at Harvard. And there they actively try to encourage students who come to medical school with artistic interests to stay involved and stay engaged. So they have a number of activities that allow students to express themselves artistically while they're still in medical school, because it's so important. And there's a whole lot of, there's a lot of research that we could talk about. We don't have time to talk about that right now, obviously, but the benefits of the arts and music for health, and even for our own health as well, our own health and well-being. So Dr. Eliza Chin is the executive president of the American Medical Women's Association, and she has been very supportive of our work. So the last two doctors I spoke about, Dr. Wong and Dr. Roro, and myself, and one other person, Dr. Ross, who isn't in this presentation, we were all in Berlin about a year ago to attend the International Association of Music and Medicine's conference, and we presented our work there. So there was just a whole lot of people talking about the benefits of music and art in healthcare, and not just doctors, people from different fields, different professions. And it was an amazing experience. And a lot of people talked about their research as well. Music, music is can impact how patients sense how they feel pain. It can reduce the impact of it can basically improve health in so many different ways, from excuse me. And so some people spoke about their research, and we had performances there as well, and it was just an amazing experience. So I want to just end with this quote from Dr. Eliza Chin: "Never underestimate the power of networking among women and our ability to achieve success through collaboration." And of course, she's focusing on women because this is a women's organization, but networking is really very important, and it can really make a big difference, and at that meeting in Berlin, I met somebody who I had almost finished my book, Girls Become Doctors. And I met somebody who who agreed to be featured in the book, because I realized that I didn't have, that Europe wasn't really represented in my book. And I wanted to have as much representation as possible, much as I wanted the book to be about people that I had interacted with at some point in time, other than the historical people. So anyway, you make lots of good connections at these meetings. You learn a lot. You learn about people's research, learn about their work, and in fact, there's a faculty member at Drexel who's a music therapist that talked about her research. She's at Drexel in Philadelphia, which is like an hour and a half from me. And I joke about how we had to go to Berlin to meet. Anyway, so networking is important in whatever field you end up in. You just never know. You just never know. And then, yeah, so that's the end of the talk. So this is the book. And if you scan the QR code, if you're interested, it should take you to my website, where you can, learn more about my work, sign up for my newsletter if you want to. And the book is, it's ended up being a memoir, even though that wasn't what I intended it to be in the beginning, because, but I did end up talking about a lot of my own experiences. But basically, I wanted the focus to be on this broad, how do I put it now? I wanted to show the diversity, the broad range of opportunities for women in medicine, for people in medicine, for women in particular, people from very diverse backgrounds and very diverse specialties, and with very, very diverse experiences, and people who bring, different strengths to what they do. And I wanted people to be able to read about all these people, in one place. And then, of course, I wove my own story into it to make it more personal, and talked about my Fulbright experience, talked about my Erasmus Mundus experience, talked about some of my medical school experience in terms of how I learned about Ida Scudder and all of that. So So anyway, so that's the book, Girls Become Doctors and Much More. And I guess that's the end of this part of the presentation. So yeah.
So we'll open the room to questions. I always love the questions. Questions are always fun. And I have a plethora of them, but hopefully a bunch of you guys have questions. My first question, though, I know that a lot of people, more so now, are non-traditional. They don't follow the streamlined path, and you were an example, a great example of that. Do you think you would have any advice to give someone when they're trying to navigate what profession that they're trying to get into? I know that you've done dentistry and you did the medical path as well, so you have a unique perspective of both ways.
Yeah. Well, thank you. It's a tough question to answer because it's so individualized. You know what I mean? The answer has to really be individualized. But what I would suggest is that explore as much as possible. You know, explore the different professions, explore different opportunities, get as much information as you can get. You know, again, I hope that this book, I mean, I hope that it really helps people. You know, this is the sort of book that I should have read when I was 15, 16, and thinking that if I was a physician, I wouldn't have time for other things. You know what I mean? So this is that book that young girls who are like me and who are like wanting to be doctors but not really sure and thinking that maybe they should have other priorities and maybe they won't have, you know, that sort of thing. That's the whole point, to share these stories and let people see what's possible. So I would say, you know, talk to as many people as you can, learn as much as you can about all the professions. And you know what? If you end up choosing one path and it doesn't work out, it's not the end of the world. It's not the end of the world. You know, it's like, it's not even if you end up changing careers, it doesn't mean that the first career was a mistake. You know, the rest of your life builds on that. You know, there are things I was able to do because of my dental training and that I wouldn't have been able to do otherwise. So I was at a brand new medical school. One of the many things that I did was to start an oral health and medical education program so that we would teach medical students about the basics of oral health, because you know, the separation between medicine and dentistry, unfortunately, can be very, very harmful, and it really ends up, it's unfortunate, but sometimes we end up having very bad outcomes because of the way medicine and dentistry are treated as if they're so separate. I mean, the mouth is part of the body, just like the eyes, ears, nose, and throat are. You know what I mean? But then we act as if the mouth isn't part of the body, you know? And then there have been horrific stories about people dying from, for example, brain abscesses that were caused by oral infections, you know? And so that's something that, I mean, obviously I can't do everything, and you know, but but I really do think that, you know, oral health should be an integral part of medical education. So yeah, I don't know if I answered your question, probably not, but yeah, but
You answered it.
just yeah, try and get as much information as you can and talk to people, spend time with people if you can, read up, and you know, and at the end of the day, you know, at the end of the day, you have to make your own decision. Nobody can make that decision for you. So sometimes you just kind of, after getting all the information, you go with your guts, you know, and if things work out, great. If they don't work out, well, you know, it's all part of the process, and you just keep, you know, make the best of it and keep moving on.
I like that. I definitely like that. I noticed that you had MDs and DO on your topic, your lecture slides. I know a lot of people always ask what the difference is between MD and DO. Do you have a personalized view of MD and DO?
Okay, so at the time I was going to medical school, I knew that DO schools existed, but I really couldn't tell you, I couldn't really say much about DOs or DO schools or you know, but I do know, what I do know is that basically, well, obviously DOs are licensed physicians, right? They're licensed physicians and they go through the same training and all of that. And they actually, to be honest, they actually do more because they do the osteopathic. They, I think the main difference is the fact that they learn osteopathic manipulations and that sort of thing. And we in MD schools didn't do that. So they, and that, so I don't know how much overlap there is between what they do in terms of manipulations and what chiropractors do, for example. But these are licensed physicians doing that, right? And like chiropractors, for example, I mean, I'm not nothing against chiropractors, but I'm just saying chiropractors aren't physicians. Now, I think DOs or the leaders of their medical schools will probably tell you that, oh, they have a different philosophy, a different approach to healthcare and everything, and they believe in having a holistic approach and all of that. But I don't think that that's so much a difference, because I mean, I feel like in my training we had a pretty holistic approach to healthcare and all that. Yeah, so they might say, and if it's you probably should ask a DO, maybe you'll get a better answer. So they might say that their whole philosophy is different. I don't know how different it necessarily is, but the main practical difference is the fact that they learn osteopathic manipulations, and we didn't learn that in MD schools.
Yeah, definitely. I've heard a lot about there's the extra classes and things, and how there might even be extra classes added to the MD program in the coming years for bedside manner and just overall patient care, which I'd be curious about. Do you have any advice on kind of that realm, the advising or the counseling of patients during your sessions?
Well, advice about what? How to approach it? Can you just rephrase the question, please?
Yeah,
So I'm
yeah.
sure what you're asking, yeah.
More so, how do you interact with patients in a way that doesn't leave them with the idea that you're just rushing through them or giving them enough time?
Yeah, well, and it can be challenging. So there's a number of things. So, we talk about empathy and compassion and all of that, and people talk about how, oh, people go into medical school wanting to save the world and, having so much compassion or empathy, and how it gets eroded once they get into the thick of things, before they even graduate sometimes, and then reality sets in and you realize that you don't really have time to talk to patients. And, so it really can be challenging. And people talk about teaching empathy. Obviously, it's something that should be emphasized. I'm not sure I believe that empathy can really be taught. But at the same time, I think it's important to emphasize the importance of communication skills, the importance of listening, the importance of, like Dr. Townsend, my former department chair, talks about the importance of listening, if you remember in that early slide. And it takes time. It takes time. And, when you're in a busy clinic situation, you have patients waiting, you're behind, it's not easy, but it's something that I think we all have to just work on, and some of these things are more systems issues where they don't give you enough time. So it's not really, so it's like, how do you balance your need to stay on time and stay on schedule and then give each patient your best? It's really not easy. It's a challenge, but it's something that I think we just have to do our best with, recognizing that we have limitations, and I think if patients know that you really have their best interests at heart, they know that you're listening, the little time you do have with them, that you're listening to them, you're making sure that they feel heard, they're likely to appreciate that. So even if you say, look, we can't address everything today, but I understand you have all these other problems, all these other issues going on, let's make another appointment to talk about that. And then apologizing when you're late, when you've kept them waiting, even if it's not your fault, just, admitting when you make a mistake. There's a lot to it. There's a lot to it, but I think it's something that we really have to, like, individually pay a lot of attention to make sure that we're being deliberate in terms of being present with patients, listening to them and making sure that they feel heard, answering their questions, and just and just being there for them, and being honest with when we have an answer. It's okay if you need to consult with another doctor, another specialist, or if you need to look something up, that's okay. We're humans and we're not expected to know everything anyway. So it is challenging, but it's something that I think that we should all continue to work on, and then taking care of ourselves too, because when we don't take care of ourselves, then it's hard to, you can't pour out of an empty cup, they say. So that's another thing that we like to emphasize. Yeah.
I like that quote. I haven't heard it before.
Oh, really? Oh, okay.
Yeah,
You'll
no.
probably hear it a lot when you get into medicine.
Okay, I'm sure I'll be tired of it in no time. You mentioned taking care of yourself. Have you ever had times where you felt that burnout feeling? And do you
Are
have
you asking?
and do you have some advice on how to get out of that or how to I don't know how maybe how you get out of it?
Try and prevent it before it happens. I, you know, so part of the reason why I push so much for, music and writing and arts, and that's all part of the message, on the one hand, we can use, I really believe that arts and music can be used in healthcare in terms of how we take care of our patients, but for our own well-being. And for you, it might not be music, it might not be art, it might be something else. It might be jogging, but the things that are important to you, the things that bring you joy, are things that you should hold on to, and those are the things that will help you find balance in your own life, and hopefully avoid burnouts, or if you are burnt out, at least help you to get, help you to get over it, and then sometimes going for therapy, if sometimes that might help, that might be necessary, in fact, just finding time. Yeah, but finding time for self-care is really so important, and it's something that I don't think was emphasized enough in our training, because we're trained to just, to keep taking care of other people, to keep taking care of other people, and then you end up, you know working so hard, not sleeping well, not eating well, and that's a recipe for disaster.
Yeah, definitely agree. Although I've definitely been in the burnout realm. It's a little hard to avoid sometimes.
Yeah.
For anyone that's trying to go into addiction medicine, can you speak a little bit on your like day to day, or maybe week to week, depending on maybe that's overly flexible, but what does that look like for you?
Yeah. So it really depends. Addiction medicine is so broad. It's so broad. So I have worked in different and because for me, because I was primarily an academic as well. So my clinical work was outside of the medical school. And early on, at least most of my time was at the medical school. So, like I said, I started working at a methadone clinic, and that I don't even know what's going to happen with medical methadone clinics now, with all the changes that are being proposed. But typically with methadone clinics, patients have to, at least in the beginning, go there every day. But the doctor doesn't have to be there every day. So you might only have to be there like a couple times a week and see the new patients, do the admissions or whatever. And even that may be changing too, because they've really relaxed with COVID and everything, and since then, they've relaxed a lot of requirements for methadone clinics. So, yeah, so even if you work at a methadone clinic, you're not necessarily going to be there all the times the clinic is open, right? There are people who run what you call Suboxone clinics, which is probably not the best name for them, because they do more than just prescribing Suboxone, but buprenorphine, which run as just regular clinics. So for a brief period, when I was still in Scranton, I worked as a medical director of a Suboxone clinic, which we did more than that. I mean, obviously we saw patients, we did physicals, we gave Vivitrol injections and all of that, and they were open like Monday to Friday. I was still involved. I was still at the medical school at the time, and but I cut back my time at the medical school because this job was going to require me to be there for at least 4 days a week. But that was just like a regular clinic, and even though I was the medical director, I'd be like the first to get there, the last to leave. I was supposed to be doing administrative work in addition to my clinical work. So that's and then I didn't really have time for the administrative work. So it was a, and when I did ask for time, they were like, okay, we just won't schedule patients for you for the last hour of the day. And that doesn't really work because you're usually going over anyway. So, but I mean, it's really hard. And then there are inpatient facilities as well, where the patients are admitted for maybe 28 days at a time, or sometimes shorter periods. And then if you're the doctor seeing patients there, you might have You might be there every day. You might be there just, on certain days of the week. A lot of places use nurse practitioners and PAs now, physician assistants. So they may not necessarily need to have a physician on site like every day. So it's very, very variable. Yeah, it's there's no one answer. Yeah, and there's so many different ways to practice addiction medicine. And my last major job, the last job, my last full-time job, let me put it that way, was basically building a research center, at an addiction treatment facility. So there too, the projects that we had, that the clinical projects that we had that required a physician, I was the physician, the study physician, but I was also doing all these other things in trying to build a research center, trying to start academic programs there and that sort of thing. So there are lots of ways in which you can, build out your career, and there's just lots of opportunities. So it's hard to say, this is what your day is going to be like. It just depends.
That's understandable. Did you have a favorite environment that you've worked in?
I don't know that I can pick one. For me, I have enjoyed being in an academic environment, but at the same time, I needed to keep clinically active, and that's why I like in the early days of the medical school, that's why I actively sought out clinical opportunities, because at the time the clinicians who were on the full-time faculty at the medical school were people who were nearing the end of their careers, and it didn't matter if they never saw a patient again. But for me, I wasn't in that position, and I knew I wanted to see patients, so I I found a way of staying clinically active. So I'm the kind of person that likes to do a little a little bit of, I wouldn't say everything, but yeah. I hardly ever do just one thing. I need to have variety in what I'm doing. And that's just the way I'm wired. And unfortunately, I've been able to, it's worked out for me that way.
And then I know that you played musical instruments before. Do you have a favorite musical instruments, or can you
Good
can you
question.
speak to any of that?
Good question. I don't know if I would say I have a favorite, but I've played the piano for the longest, and there's certain things I like about the piano that you can't do with other instruments. But the ukulele, I only started playing about 10, 11 years, 2014. But I like the ukulele because it's so convenient. It's easy to play. You can just learn a few chords and play, and it's easy to carry around. And it's good for group singing and that. It's very convenient. So the ukulele and the piano are the instruments I play the most. I don't know if I would pick one favorite though. Yeah, it's just yeah.
You'd be surprised. Some people can play like 6 or 7 instruments and then they have a favorite. Do you speak any other languages, or have you
So
had
I
any?
speak Yoruba. I speak Yoruba, but English is my main language. But so Nigeria has a lot of languages, but English is the official language. Yeah, English is the official language, and that's what I what I speak best and most. But so I understand Yoruba and I can speak it. I know a few words in Hausa, which is also a Nigerian language, a few words and phrases, but I can't really speak it. And I spoke a little bit of French when I was younger, but you know, I still know a little French. I can't claim to speak it, and then and then Spanish just by osmosis. I know a few phrases and common words and things, but I can't speak it.
It's always nice knowing another language. I
Yeah,
definitely would love to learn Spanish because it's very,
yeah.
very well
Oh,
used in the States.
that would be helpful for for your medical career, definitely. Yeah.
So I know you're a writer. A lot of people like to ask about podcasts. Do you have any favorite podcasts?
Oh boy, I wouldn't say I have a favorite podcast. I listen to so many different things. I wouldn't say I have one favorite one. But if you're looking for a medical podcast, Kevin MD, I don't know if you're familiar with. So there's a website, Kevin MD, where a lot of doctors, or not just doctors, health professionals write. In fact, you could probably, I don't know if they take things from pre-med, they might, you could try, because I know medical students can submit, and so it's a place where it seems pretty easy to get essays published there, but then they also have a podcast. So this physician, Dr. Kevin Poe, started this site. I think it's now part of Medscape, but it's still Kevin MD anyway. Yeah. And then he has a podcast. So sometimes he'll invite people who've authored articles to appear on the podcast. So I've written articles for them and that they've published, but I've never appeared on their podcast.
Would be nice. I love listening to random doctors talk, but Venkata, hopefully I did not butcher your name, but it's asked, what are some useful skills or experiences that you believe would be valuable for an aspiring medical professional, clinical or non-clinical?
Useful skills. It really depends on what your interests are. I mean, I think that I think it's good to read about other people's experiences, and because you get a lot of ideas from reading. We were just talking about podcasts. You can get ideas from and inspiration from reading, and then, okay, back to the arts. For example, I wish I had known some of these things when I was younger, but like I didn't even know, like my interest in photography was something that developed later. Yeah, it was like, okay, before I went to medical school, I was starting to like really get interested in photography, but I didn't realize I wish I could have integrated my interest at a much earlier age, right? So I think that whether it's art training in arts or training in music, I think those things can really enhance learning. And let me give you specific examples. So somebody who is trained as an artist, um, who has a very keen eye, and they can really pick up on, you know, subtle differences in color and texture when they look at a piece of art. That could be translated to the clinical setting where you're looking at an X-ray, for example, and then you might pick up on subtle changes that somebody who doesn't have a trained eye wouldn't see, right? Or dermatology, a skin condition that's very, very, that's not very obvious, but the person who has a trained eye, who knows how to pick up, who's used to picking up very, very subtle changes in color and texture, might pick it up. So those are some examples, and then there are ways in which I really believe that music can enhance our learning too. There's just so much research going on about music and the brain, and it's just it's really very fascinating. So I would say, just stay active, read a lot, you know, listen to good podcasts, educational podcasts, and then, never stop learning, and make sure you have outside interests as well. I don't believe in this left brain, right brain dichotomy. I think we have one brain for a reason. It's the left and right halves of the brain are supposed to work together. That's why we have the corpus callosum, which is the part that joins the two. So anyway.
We're all humans.
Yeah.
Don't be a robot.
Exactly.
You mentioned working to help build a research department or building. Have you done any research, and what types of?
Oh yeah. That we were doing research. That's what I was hired to be the medical director of research. But in that, my job was to the position was about building a research center, not so much the physical building, but yeah. So and I've done research in the past with students and things. We had at the medical school in Scranton, we had community health projects on different topics that we supervised. But the my more recent position, we were looking. There were different projects, but the one big one was a clinical trial on GLP-1. Are you familiar with GLP-1 agonists that are being used in? They're being used for weight loss now, like like Ozempic and all of that. Okay, it wasn't Ozempic, but we were looking at a particular drug looking at using it for addiction, and now it's actually being used, liraglutide, because it's just interesting when you think about the different pathways, and I can't get into all the complexities right now, but so that was one project we were looking at to see if it was if the drug would be effective, if the liraglutide GLP-1 agonist would be effective in treating opioid use disorder. There was a study that they had pretty much done the main study before I got there, but it was on genetics, looking at genetic markers and predicting who was more likely to get to develop an opioid use disorder if they were given an opioid, and actually that's the marker, the instrument that they developed has actually been approved by the. It was just one of the study sites, but the marker has been approved by the FDA for use. Yeah. And then there were other studies. Okay, somebody says we have only
That was
5
me.
minutes. Oh, okay, yeah. Yeah. So basically, we were looking at treatments for opioid use disorder. We were looking at predicting who might develop an opioid use disorder if they were exposed to opioids. And I'm trying to think what else. And then also looking at suvorexant is a sleep medication, and we were also looking at to see if that could be used to treat addiction. One of the things that the reason behind that being that sleep deprivation is a risk factor for relapse in addiction. So if you can help people with their sleep, we were looking to see that, okay, if we take care of their sleep and they don't have the sleep problems anymore, would that help to reduce the risk of relapse? So yeah.
I think Zemi has a question. If you want to unmute yourself, you can.
Yes. Hello there. My question is, was dentistry harder than medicine?
I don't want to say anything is harder or easier than the other, because it just depends. It really depends on a lot of things, and it depends on the person and all of that. Basically, neither of them was easy. They were both hard. They were both hard, and it was just a very different experience. Yeah. So, and don't do what I did, please, unless you really want to. Unless you really want to. There are actually a lot of oral surgeons have both medical and dental degrees, and that makes sense because of what they're doing. Yeah. So, and there is a specialty called oral medicine, all that. Yeah. So, but yeah, I think that like I said earlier, I think all medical students should have some oral health training, but you don't have to go and get a dental degree unless you really want to, unless that's what you really want to do. Thank you.
Definitely some chaos there. I'm surprised. Although there's more and more dual programs coming out. I've been surprised. A lot of MD PhD routes have opened up over
Yeah,
the
MD PhD, MD MPH. In fact, yeah, and then I got my MPH before medical school, but there are a lot of combined programs, MD MPH programs, MD MBA programs, and then like you said, MD PhD programs. So there's lots of opportunities.
Oh yeah, I'm very sure. Maybe people could create their own. I'm sure that'll morph over the years. Can you run through, because I know a few people might be interested in addiction medicine, maybe a typical case that you would see?
Typical case. Well,
Or is there
again,
like common occurrences, or you can talk about common addictions?
Okay, you know what? Let me see if I have my book. I'm thinking. So I also co-wrote a book on methadone. That's for patients with opioid use disorder who are considering methadone treatment. And we had some case studies in there. Let me see if I can bring something. How much time do we have? I think that if I can just read a case study, I'm not sure. I think I might have to go into my car, or let me see if I can bring it up on my computer. Sorry.
I always love the chaos that makes people seem more human.
Yeah. So I think if I can find the document, I mean, I could run into my car. I'm pretty sure I have a copy of the book in my car. Do you mind? My car is just in the garage.
No, go for it.
I can just go grab the books and just read you stories from there. And I think that would be more meaningful.
How's everyone doing? Thumbs up all around. Does anyone else have any questions? Because we're probably gonna wrap things up. If anyone has any last minute questions, I will throw your question into it. I'm gonna take that as a no. Well, also, if any of you want, you can private message me or Manasvi, who's on my screen next to me, but maybe not.
Okay, so I'm back, but I minimized my screen, so I'm trying to think of how do I bring it back up now? Okay.
Well, we see you perfectly.
You see me? Oh, you see me? I want to see you too. Yeah, so this book is called Navigating the Methadone Maze, a guide for patients and professionals. And my colleague and I co-authored this. It just came out in June. But I want to just read, yeah, because rather than thinking of something off the top of my head, we included some case scenarios here, patient case scenarios. So this is Sean. Sean says, I first started using opioids after I twisted my knee playing touch football with my friends as a young kid. My knee swelled up and my doctor thought I tore my meniscus. The MRI showed a lot of swelling, but no tear. I continued to use the oxycodone or OxyContin that he prescribed. Then, when the swelling went down, I continued to ask for more prescriptions, and my doctor continued to write them. At first, I only used the Oxy on the weekends and with a few friends. Then I started using them during the school year. When my doctor stopped writing scripts for the Oxy, I started buying them on the street. To get a better high, I started snorting, but never injected, thinking that meant I really didn't have a problem. So that's a very typical story. That's a very typical type of story where they have an injury, they go to the doctor, get treated, and they get started on an opioid, and then they end up, unfortunately, needing more and more and more of the pain medication and getting addicted. That is so, so common. I don't know how many patients I've seen who have had that kind of story. Obviously, not the exact same details, but that same sort of story where they started out with legitimate prescriptions for a legitimate injury or condition, and then ended up getting addicted. And then the problem is that what often happens is that when the doctor now realizes that they're addicted, they now kick them out and they say they can't prescribe for them anymore. And then what do? They go use heroin. That is so common, unfortunately. All right, so let me read another one. I have been to detox 3 times. This is Carolyn speaking. I've been to detox 3 times. I tried abstinence programs, but I was only able to stay clean for a few weeks. I tried Suboxone, at first buying it on the street, then in a real program, but I sold them to buy more drugs. I need to find something that works better for me. Someone told me I should look into methadone, but I don't know anything about it. So anyway, it's for patients like Carolyn that we wrote this book. Yeah, so if you have any questions, let me know. I mean, I can still read a few more if we have time.
Oh, wow. Lindy has a nice long paragraph. You ready? It says, hi, first off, thank you so much for your time today and sharing your experiences. I really enjoyed listening to you speak. What intrigued me was the emphasis you put on external hobbies and activities that you should involve yourself out of the medical-based skills. Speaking of books, where can I purchase your book? I'm interested in reading it.
Oh, thank you so much. So the last slide
I
actually
was gonna
has a
say, I
link.
still have your slides. I can definitely pull up the last
Thank you.
slide.
Please, thank you so much. Yeah. And I actually have other books. So I have combined my writing and my photography, and I have other books as well. One that has pictures of butterflies that I took, and then information about butterflies, one on giraffes, one on squants. Anyway, you'll see that if you go to my author page, but that link will take you directly to this page, the page for this book. Thank you so much. I appreciate that.
And I did, for any of you interested in the chat, put the methadone book on there as well. If any
Oh,
of
thank you.
want that.
Thank
Oh my
you.
gosh, I don't know if it's Lois or Louis or Luis.
It's Lewis. Hi.
Hi.
I did have a quick question. I was just wondering, how do you see artificial intelligence changing the landscape as a healthcare professional? Like, have you had any experience with that? And
I
if you
am
could
so
share
sorry.
your.
That is a great question, but I'm so uneducated when it comes to AI. I know that it is changing the landscape, and it probably will more and more, and it's kind of scary, to be honest. But I also think that we just need to be, rather than being afraid of it, we need to embrace it. I know that medical schools and I think some health systems are, finding ways of using it effectively, figuring out how they can use it effectively as opposed to, avoiding it. And even for me, I mean, I write a lot. I don't believe in using AI for writing. I'm like, look, AI doesn't know what's in my mind. I know what I want to write, but I've realized that you don't need to count, like in terms of writing now, you don't need to like depend on AI to write something for you, but you can ask AI to give you ideas, right? Or give you if you want to write an essay on something, give you an outline, and it can give you an outline, and you may or may not use the outline, but that's a way of using AI without being totally dependent on it, or looking for a title for a book, for for another book I'm working on. The person who works on my website and does marketing for me, she does promotional stuff for me. She sent me like a title or a subtitle, and then I was, not sure I wanted to use it, and thinking about other alternatives and everything. And then eventually, I saw an AI summary. I don't know what I typed in. Was it the title of the book? Anyway, whatever it was, I ended up seeing a phrase that looked very much like what she had sent me, and it was AI generated. And I realized, oh, she didn't make this up. She must have asked AI for it. That's why it looks so familiar. So yeah, I mean, I think we should think about ways in which AI can help us to be more efficient without becoming totally dependent on it. And in terms of healthcare, I really don't know where we're going with that, but I just think it's something that we're going to have to. It's a reality that we're going to have to embrace. In fact, one of my colleagues wrote an essay. If I can find, maybe I'll share the link with you if I can find it online, and then Kira, you can share it with them, because he wrote like a futuristic essay imagining what healthcare would be like in 2063, and it was scary, but, but it was all along the lines of, AI taking over and all of that. So what are we going to do about it? So I'll see if I can find the link, because I think it was a really good essay, and it's something that, especially if you're interested in that, something that I think that you would enjoy.
Wow, that sounds very cool. Tala is going to be our last question of the day, and then Manasvi is going to wrap us up. But if you do find that link, I'm happy to send it.
Okay, sure.
Hi, can you hear me?
Sure.
And
Hi. So, I'm actually located in Villanova, PA. I don't know if you're familiar with that
Villanova,
area.
I know of
Yeah.
Villanova. Yeah,
Yes.
yeah.
So my question is, um, I'm in the pre-med process and I'm considering going into a post-bac program, and I am considering applying in the West. I wanted to get your input on how you see healthcare in the East Coast compared to the West Coast, because I have an understanding based on my father, who's a cardiologist at Jefferson Einstein, that East Coast healthcare is much more educational in some senses, and they're more advanced in their resources. So I that's his bias. I don't believe that, but I definitely want to get your input because you're located in Scranton.
So I'm in Reading now. I was in Scranton
Oh, sorry.
earlier, like years ago. Yeah, but sorry, because I kept talking about Scranton. Well, that's where I spent most of my career so far, up till the pandemic. I am sorry, I don't know. I've never heard that. I've never heard it, and I really don't know much about. I don't know enough to say that the West Coast is that different from the East Coast. But I do have friends who live on the West Coast, and I could just ask and get back to you. So Kira, if I have follow up, like getting that link, and if I get any answer to this question, are you able to communicate with the people asking the questions?
we can.
To
You can
send
also go on your course page and you can add that in your little comments section, and people.
Oh, okay. I didn't know I had a course page. I didn't know I had a course page.
You
Okay.
have a course page.
Yeah, okay, thank you. All right. So Tella, I can ask my my friend in California, but I've never really heard of anything. So I'm sorry, I can't really answer that question.
Yeah, no worries. I just one last question. Is there a reason as to why you decided to settle down in Reading and not think of or explore other places for job opportunities?
So the reason I came to Reading was for the job, the research job, the research center job. That was a huge opportunity. It was a huge career opportunity, and that's why I came here. And then when the job ended due to reasons beyond my control, changes in leadership led to, anyway, I stayed here because it just
fell into place.
Yeah,
though.
I just
Just convenient.
I do like being here.
Okay, well, that's interesting. And you enjoy it, I assume.
Yeah.
Okay, well, that's nice to know. Thank you.
You're welcome.
Nice talking to you.
Thank you. Same here.
Okay, so I think we can start wrapping up the session. So yeah, so for the wrap up, I think let's have everybody share out what brought you to the session today. Does anyone go first?
I'll just say that I initially came because I heard psychiatry and that's all I needed to hear.
Anyone else? Okay, I'll take that as a no then. Well, I'll see you guys when I learn about. Is there anything specific? For me, I think I'd want to dive into addictive medicine and basically more the psychology behind it and how it affects the brain. Because Dr. Simoyan's thing really lured me in today. And yeah, we'd love if you guys could share your insights on LinkedIn and just like tag PHS and help us grow our network and yours too. And once again, if you're interested in being part of our team, you can register from our website. And the roles for our leadership team are also always open. So yeah, just a reminder for that. And once again, please, we would love your donations if you're able to. And quoting Kira, what she said before, even $1 is really helpful for us. And yeah, we would love to hear your insights on how it went. So if you would like any volunteer hours or certificates that you could put on your resume for medical school, yeah, just feel free to take the quiz on the PHS website to get your hours and certificate. And if you joined late or had any technical difficulties or anything like that, there's no issues. You could visit our YouTube channel on pre-health shadowing and watch any of our previous sessions. And we have sessions every week. We have another one coming up really soon. So make sure to catch up on all our sessions. And yeah, thank you so much. Does anyone have any final questions before we wrap up the presentation?
If you do, you're welcome to stay. I just wanted to say thank you so much, Dr. Simoyan.
You're welcome.
Presentation, and I love that it was very diverse. It wasn't just fixated on one topic.
Thank you. Thank you for having me. I hope you all learned something. Yeah, and yeah, my pleasure. My pleasure. Please feel free to check out my website if you want to. If you want to sign up for my newsletter, anybody you can. And yeah, and feel free to reach out. All right. So how do I email you, Kira? Is it just the pre-health shadowing email?
The info at pre-health shadowing will go to me as well. But there's also marketing team at prehealthshadowing.com, or you can just message me privately. It's Kira at prehealthshadowing.com.
Okay. All right. Thank you. All right. Take care.
Have a
Alrighty.
good